What advice would an infectious disease specialist give you about coronavirus? We're going to find out today on The Wrinkle. So I am a doctor, but there are doctors who are very, very specialized in the care of infectious diseases. A colleague of mine is Dr. Gregory. She's an infectious diseases physician and a medical microbiologist. She's also an assistant clinical professor at McMaster University and a full-time mom of 2 small kids, but she took time out from all of that to give me an interview. We're going to talk about coronavirus in general and also about what it means for older adults and their families. I hope you enjoy the interview.
So, Dr. Gregory, thanks so much for agreeing to talk to us today. And, you know, most of my listeners are older adults or they're caring for older adults. Mm-hmm. So, you know, keep that in mind as we go through some of these sort of frequently asked questions. And you must be asked a lot of questions these days as a specialist in infectious disease.
That's for sure. Family, friends, colleagues.
Yes. So, you know, can you give us a snapshot? And I know this is changing all the time, but what is coronavirus and why, you know, how is it different than the flu? Does it relate to SARS? Give us kind of a sketch.
Yeah.
If you can.
In terms of like a technical answer, they're all RNA viruses. They're all respiratory viruses. But there are some key differences. Influenza is a bit more distantly related than SARS is. SARS is a little bit closer related because it's also a coronavirus. But the key differences is in the transmission in terms of comparison to SARS. SARS is much more difficult to transmit from one person to the other. And generally, when you look back at the SARS outbreak, it was close contacts as well as healthcare workers when patients became quite ill that were getting sick. Unlike this coronavirus, as well as with influenza, where it's a little bit easier to transmit from person to person. In terms of comparison to influenza, unfortunately, it does have, for one, a higher mortality rate associated with it, but two, it is so different than other coronaviruses that the population in our world doesn't have any immunity to it. Versus with influenza, we tend to see small changes over time, and so then we end up seeing a population where some people have partial immunity, and therefore not everyone gets sick at the same time.
Okay, so that's why we're calling it novel coronavirus, because it's kind of a new
It recently made a jump from the animal world to the human world.
Okay. And which animal was that? Because I've heard different things, but do we think it was a reptile, like a snake, or?
Honestly, I've seen many different reports. I'm not 100% sure. In terms of looking at timelines, it sounds like it likely happened in November of 2019, with the first found cases in December. But when they try to map it back, they're thinking the jump happened in humans in November. But honestly, I'm not 100% sure of which animal it came from.
Sure. Okay. So, and does coronavirus cause a SARS type of, because some of the things I've read is sort of referred to corona SARS or COVID-SARS. So how is the SARS kind of what could happen if you get coronavirus?
You could get, not so much that you would get the old SARS, but some patients do get that sick, as sick as those that got sick with SARS. And because it has some similarities, it got that name. Because it has a different mortality and a different transmission level, many people are trying to call it, COVID-19 as opposed to SARS-2.
Okay. All right. So we should refer to it as COVID-19.
I think so.
Okay. And so what do we know about how it's behaving around the world? And what does that tell us about how it's likely to behave in Canada? Because we're at 300 and something cases now. What can you tell us about that?
So it seems to rapidly transmit from person to person. And in areas where the have hit numbers similar to ours, without aggressive methods of trying to control spread, it has continued to follow a logarithmic growth, which is lots and lots and lots of people, you're seeing doubling times of the numbers every 2 to 3 days. In terms of trying to control it with, impressive, unprecedented testing, South Korea has managed to control it quite a bit. Nowhere else in the world has been able to replicate what they have done. The pure numbers of testing that they were able to come up with in such a short period of time, as well as to have a number of individuals to run those tests. Not everyone's been able to do that. The other methods has been governments strictly controlling where people go in terms of quarantine. And with that, we've seen some flattenings of the curve. However, generally it's been done in areas where it's already somewhat out of control. So if you look at other Western European countries that are somewhat out of control with their numbers, they generally haven't tried starting as early as Canada's trying to flatten the curve.
So would that be like Italy, for example? We hear a lot of
Italy, most definitely, for an example, mostly because they didn't seem to get the same head start as the rest of the world has had. But even when you look at France, Spain, Germany, they had a lot more cases than we have had in Canada prior to introducing methods of trying to control it, as well as their distributions are quite a bit smaller than our country in terms of our number of cases and the land mass that is Canada.
So do you mean like it's more crowded there? So it's
yes, yeah, more crowded there.
Okay, for sure. Right. So those are, and even in the US, there are some hot spots, right? Are there still places that are considered hot spots like San Francisco and New York and Seattle?
Yeah, most definitely. I think that there's much more hotspots than we are aware of, as they have really struggled with the ability to test. All of the United States has been testing at levels similar to the levels that Ontario has tested, and yet we represent less than 5% of the population that is the United States. So comparison-wise, it's hard to know how bad the outbreak is in the United States due to levels of testing.
Okay, that's important. And yet we don't want people here to, if someone's listening to this, so they're hearing about the importance of testing. But as an individual, we really don't want people to get tested unless there's a need, right? So unless you have symptoms and have been exposed to someone who's confirmed, right? Like who should get tested?
Exactly. We want to prioritize our tests to those in hospitals so that we can ensure that those that do test positive, that they can be appropriately isolated from those that do not test positive. We want our healthcare workers tested that have symptoms to ensure that if they don't have it, they can return to work as we're going to need them. These are our nurses, our doctors, our PSWs across the country. In addition to that, we're also doing heavily testing within our nursing home population, because an outbreak there would be very detrimental to our society, as well as in native reserves.
Okay.
That's kind of where we're going to focus on our testing, unless we have a huge increase in our testing availability.
Right, because there are
Instead, if you have symptoms, stay home.
Yes, yeah, and though that's kind of what, in our household, we've kind of talked about it, and yes, we've decided that, we would just, and we have some healthcare workers in our household, but really, for most of us, yeah, we're going to stay home unless we get symptoms that are severe enough that we need to get medical help, and then we won't have a choice.
Exactly. In our household, we actually also have symptoms right now. It's hard to know if they're COVID. I assume that they're hopefully not. But yes, my toddlers had a fever for 4 days or 3 days. And so we are doing it day by day, but we are, yes, most definitely isolating ourselves from all others, just in case it is COVID.
And you mentioned, I'm sorry to hear about your toddlers. I hope everyone feels better soon. That can be miserable. But you mentioned that the getting an early start on the isolation is really important. We're hearing that message. So for example, what about someone who wants to visit their grandchild, or the grandkids want to come and visit? So that would be a small gathering. What advice would you give to the grandma who's feeling well, not having any symptoms? What should they do, or what, about these visits?
So as our numbers climb, and I think we're probably already there, especially if you're in a major city in Southern Ontario, which I imagine is where most of your listeners are, I think it's time that you at least start with a 14-day separation from your grandkids.
Okay.
Now, if they can limit who they're seeing, then hopefully after that period of time, you could spend some more time with them. But the more people you see, the more likelihood it is that you're going to get sick. And in studies in children, they could potentially transmit with very minimal symptoms. And when you look at kids, especially young kids, they often, have mild symptoms of cold, runny noses. And as much as that isn't a classic symptom of this coronavirus, it's hard to know if it isn't a symptom in that age population. So for now, it's probably best to avoid some grandparents. We as a family had already decided to avoid grandparents for, like I said, 2 weeks before we end up getting our fever. And now we know that it was the right choice.
Yes. And I'm sure it's not easy, right? It's hard on
everyone.
So that's why
I imagine there are many grandparents asking to see grandkids.
Yeah, and vice versa. And so virtual, like you and what you and I are doing, I mean, I feel like I'm having a convo with you and I can see you. And so these kinds of tools are awesome, and they are free, right?
Yep.
So, and a lot of people have, like, you can do things on Google Hangouts or FaceTime or things like that. So that's what I would encourage people to do.
Most definitely. And we've been doing that with my parents so that my child can see her grandparents that she misses, definitely.
Yeah. And we hope that within 2 weeks or so, we will all be able to reunite and get back to a more normal type of lifestyle. What do you think is going to be the timeline?
I think that would be more in terms of small groups. If you choose to, if you pick a small group of people and you choose to isolate from other people, I think that would potentially be reasonable.
Okay.
But I'm talking about quite small groups. Older people connecting with like 2 to 3 other people only. I imagine that we're going to be isolating for a month to 2 months. Would not be unreasonable as our hospitals ramp up their ability to see people. As well as we get out of flu season, there'll be more beds available in the event that more patients are sick.
Right. Now, what about within a household? So suppose you are in a household where there are some older adults as part of the family unit. So say you have a grandparent, a parent, and some kids. So within a home, what are the things that we can do to keep ourselves as safe as we can? Unless we all, like my teenagers do that kind of instinctively. They retreat to their rooms and, just come out for
sure they do.
What are things people could do within an intergenerational household, do you think?
Okay. Washing hands, washing surfaces, using a bleach type base surface cleaner. If someone is sick, if at all possible, have that person have their own kind of bathroom space while they're getting well, and have that person retreat to their room, especially if there's an older adult in the home. But really, it's about also staying healthy in general, making sure you're taking your medications regularly, that you're trying to stay fit, even though you might feel a little bit shut in, as well as getting some good sleep, just to try and stay as well as one can.
That's really good advice. That's good advice. Yeah. And thank goodness the weather is getting a bit better because, I've heard people say, oh, when the weather changes, that'll help fight the virus. Is that true? I don't think there's any truth.
I don't think that it would necessarily help fight the virus itself. But we do know that that there is more flu in the winter seasons, and part of that is the fact that people are not spending time outdoors, and they tend to be more in small indoor spaces together. So I think outdoors helps more so than the weather itself. but people are more willing to be outdoors as it gets warmer.
That's great. Okay. Well, that makes sense. That does make sense.
Yeah.
Yeah. But it's not like the sunshine burns it away or something.
I don't think so.
Great.
Not enough anyway. In terms of playground equipment, I think it's probably on there even with the warm weather.
Yeah. Well, that would be good I find one of the hardest things is not touching one's face. Like the number of times I almost want to wear a mask just as a reminder to not touch my face. You know, it's hard to not do. Yeah. So, speaking of flu season and that, one question I have is, should we be doing some of these things every year? Should we, because, the travel season is probably a season where there's a lot of spread of things, right? Like in the winter time, am I right in thinking that people are getting exposed to things and kind of bringing them home like every year on a regular basis?
They are, but it's really hard to be socially distant from everyone every single year. It's not an easy ask to tell people to not spend time with others. Humans are social beings, and so I think that in itself is probably too much to ask for every flu season. But the things to do every flu season, really to do all the time, is the eat well, sleep, stay fit, take your medications. But social isolation, I don't think I would recommend that all the time. With every flu season.
Travel, changing people's travel types of.
If you have a lot of comorbidities, it's probably not the best time to travel in terms of the winter. But if you're heading somewhere, warm where everyone's not going to be clustered inside, then that isn't unreasonable. In terms of looking at things like cruise ships, they've always had issues with infections on board. And that's why they've always had fairly strict hygiene rules. Nonetheless, diarrhea outbreaks happen on cruise ships prior to COVID outbreaks on cruise ships. So that is always a possibility.
How many infectious disease specialists do you think are on cruise ship manifests? Like, is that just something that makes an infectious disease physician cringe, the thought of a cruise?
I think they still enjoy them. They have not been, I think you would have seen a whole lot less because we've been talking about COVID-19 within infectious disease groups since late December, quite regularly. And so I don't think there was too many of them on cruise ships this particular winter.
Season. Okay, fair enough. Now, I should ask you about long-term care, because that is something that, long-term care homes and retirement homes I'm seeing. And if you look on the public health website, there are recommendations for people living in long-term care. And that's another, that is quite a difficult thing, because the high-risk population, very congregated group, like all the meals are sort of in a group and things like that. But boy, like the need for social interaction is also very high. So, what do you say about that?
I'm torn. A lot of nursing homes, long-term care homes and retirement homes have kind of closed down. The number of individuals that have let me know that they no longer are seeing their loved one regularly because it's been, quote unquote, closed after they've done it, daily for years or weekly for years. It's not with an easy choice that board of directors of these long-term care homes have made that choice, because as we've seen in British Columbia, it's very easy for this virus to move through and cause deaths, with all the deaths in BC to date being related to a long-term care home outbreak. So I don't think it's an unreasonable request. If you are going for, outstanding reasons, then I would highly encourage that you do take an appraisal of how you're feeling. And if you feel remotely unwell, that you do not go. And I'm not saying, don't go just because you have a cough, shortness of breath or fever. But even if you're starting to have symptoms like a sore throat, you probably shouldn't be going into something as high risk as a long-term care home. And the same goes for people that work there. we're asking physicians to limit even their visits in long-term care right now, to try and decrease the number of people entering that space.
Yeah. And I mean, I was just thinking that maybe we could have it like a one visitor policy, right? And really do that screening and even just have one visitor be allowed to come. I wonder if that might be a compromise, but it's
a potential thing. Although if you have 300 people in a long-term care facility, that's potentially 300 extra people that you're looking at. And so I can see why some places are discouraging that and really limiting it to residents that truly need that same person that they're seeing regularly. And again, the same strategies that we would encourage for people at home in terms of video conferencing. I'm hoping that long-term care is trying to facilitate that somewhat with people's loved ones if they can at all.
I hope so too. And if there's any rich person listening, or a patron, somebody who could donate iPads or donate devices, that would be so great, because that it does make a difference. And virtual doctor visits too. I really hope that I've been trying to do that. We've been offering that to some of our patients. I'm on vacation as it happens for these 2 weeks, but and there's not a ton of uptake, but I'm hoping that people will consider it, because it's, even in the future, like, it can save people so much time and parking and effort. And every time
Definitely
comes into a doctor's office or a hospital, there's a risk of getting an infection, right? So
exactly. As an physician, I've offered virtual visits for probably the last 6 months. The people that most could use them are often the elderly, because of all the reasons you mentioned in terms of the difficulty of parking, of having a loved one, take time off work to bring them. And yet it is the hardest group for technology uptake. And so despite offering it for the last 6 months, I've run into major problems with it working. Not so much that the equipment doesn't work. If I set it up with a 30-year-old, it works just fine. But
although we struggled
hopefully
to get it right.
We sure did. But hopefully the times are changing and it'll get easier.
I hope so too. Yeah, because I think that's the way of the future. Okay. So what do you think? Do you think we've covered kind of a thumbnail type of thing? Like, do you think there's anything else you would want to tell older adults or caregivers of older adults that they should know, coming from an expert in this area?
Not really, other than just to kind of summarize. If you are the caregiver of an older adult, they really need to be your priority right now, in terms of you need to try and avoid all others as much as possible. You need to take care of yourself, but consider more virtual visits with your friends, so that you can be the healthy person that is ensuring that your loved one that's older has some one-on-one time with you. Everyone should be doing social distancing right now, but it's far more important for our older adults to practice it well, because they are at the highest risk.
Okay, that's great. And I do find that a lot of things like churches and other places where older adults might be likely to go there, they are being very helpful in terms of canceling things, offering virtual services. So that's good. So that's really good.
For sure.
Yeah. Well, I can't thank you enough. I really appreciate you taking time out of your day and all the things you have to do. It's so great to hear from someone who's specialized in this area, and I'm sure keeping up on the latest developments. We may call on you again during this period of time as things are changing. But I just want to thank you so much, Dr. Gregory.
Exactly, and that is where things sit right now. It's possible we'll have to have even more extreme measures as cases, unfortunately, are likely to climb.
Right.
Okay.
Right.
You're welcome.
We'll stay in touch. Thank you so much, and all the best
good.
to everyone in your house. Bye-bye.
Great.
Thanks for watching. I hope you found it informative. If you want more information about coronavirus, the public health websites are very, very good, and their information is credible. I'll leave a link down below. If you want to learn more about aging, as usual, go to www.thewrinkle.ca, and we'll see you next time.